Welcome to the deep dive. We're jumping straight into a stack of sources today. Articles, guides, research papers,
Yep, quite a pile.
all focused on something that might sound super specific. Salivary mucocele in dogs and cats.
Right.
Now, stick with us, because while the name's a bit clinical, these sources, well, they reveal some genuinely surprising stuff about this condition. Our mission is to cut through that complexity, give you the key nuggets you need.
Exactly. And if you haven't heard the term salivary mucocele, you might think, oh, that's rare.
Yeah.
But really, it just boils down to a swelling. Leak saliva causes it.
Leak saliva.
And surprisingly, at least in dogs, the sources say it's actually the most common issue with salivary glands.
Really? Most common.
Yeah. So pretty relevant if you own a pet or, work with animals.
Okay, leaked saliva, swelling, simple on the surface. But where do we start unpacking this? What is it, fundamentally? How does that leak even happen?
Well, okay, the sources explain it's not a true cyst, medically speaking. It's what they call a pseudocyst.
Pseudocyst, okay.
Which just means it's a cavity, like a little bubble that forms in the tissue.
Yeah.
But unlike a true cyst, it doesn't have its own special lining of cells.
Okay.
Instead, this cavity is just filled with saliva that somehow leaked out from a salivary gland or one of the ducts, the tubes connected to them.
Right, a damaged duct or gland.
Exactly. And when that saliva leaks, the body kind of sees it as an irritant. So it tries to wall it off with something called granulation tissue, which is basically just, scar tissue that forms because of inflammation.
Got it. So damage happens, saliva spills, body tries to contain the spill with this sort of makeshift wall, not a proper cyst wall.
Precisely.
And where are these salivary glands located in dogs and cats? I know we have a few.
Yeah, they have several pairs,
Yeah.
similar to us, but positioned slightly differently. The sources talk about four main pairs.
Okay.
You've got the parotid up near the base of the ear,
Right.
the mandibular down near the angle of the jaw,
Okay.
the sublingual, which runs along the floor of the mouth under the tongue, and then the zygomatic, which is tucked away in a kind of surprising spot,
Where's that?
right behind the eye, inside the bony socket, the orbit.
Whoa, okay. Behind the eye. That already sounds like trouble.
It can be, yeah. And there are also some smaller buccal glands just scattered in the cheek tissue.
Right. And the sources seem to point to the sublingual duct rupture as the most common starting point.
Yes, that seems to be the consensus. That major sublingual duct, often running really close to the mandibular duct, that's frequently the culprit mentioned in the literature.
Okay.
And because these glands and ducts are, in the neck, under the tongue, even behind the eye,
Yeah.
the actual signs you see from a mucocele can pop up in places you wouldn't immediately think saliva or, digestive system.
Okay, so a leak walled off by the body, often from the sublingual duct, glands in various spots. Do the sources tell us who gets these? Like specific breeds, ages?
They do give some signalment details. Pretty consistently, they say mucoceles are about 3 times more common in dogs than cats.
3 times, wow.
Yeah. And while any breed can get them, some pop up more often in the reports. Miniature pedals.
Oh, yeah.
Especially for the pharyngeal type, that throat one.
Yeah.
Also German Shepherds, Dachshunds, and Australian Silky Terriers.
Interesting.
There's also a slight statistical lean towards males getting them more than females.
Okay.
But interestingly, no specific age.
Mm.
A puppy could get one just as easily as, an older dog.
Huh. Fascinating about those breeds. Now, you hinted the location determines the type of mucocele. Can you walk us through that? How do the sources categorize them? It sounds like the same problem looks totally different depending on where the saliva ends up.
Absolutely. The type is basically defined by where that lead saliva collects, and that usually links back to the damaged gland or duct.
Makes sense.
So the cervical mucocele, that's the most common one.
The neck lump.
Exactly, that classic soft, fluty swelling in the neck area,
Huh.
like right between the lower jaws or near the angle of the jaw, usually from the mandibular or major sublingual gland duct leakage. They're really close together there. Then there's the ranula. This one's sublingual, right under the tongue. Often on one side of that little tissue band, the frenulum, also from mandibular or sublingual leakage. And the name ranula is kind of neat, comes from Latin rana, meaning frog.
The frog. Why?
Supposedly because these soft, bluish swellings under the tongue look a bit like a frog's throat pouch.
Huh. Okay, I can picture that.
Then the pharyngeal mucocele. This one's trickier. It's located in the wall of the pharynx, the back of the throat.
Be burn.
Yeah. Often happens when a ranula extends backward, or leakage from the major sublingual gland just collects there.
Okay.
The zygomatic mucocele, that's the one from the gland behind the eye. So the swelling is ventral to the eye, right in the orbit. Its location is key. Leads to some very different signs.
I bet.
The parotid mucocele is less common, located near the jaw angle below the ear. Involves the parotid gland, naturally.
Right.
And sometimes, though less often, you get complex mucoceles, where saliva leaks from 2 or more glands.
Okay, wow. A swelling under the tongue called a frog, one behind the eye. That's a much wider range than just a neck lump.
Definitely.
So given those locations, the signs a pet owner or vet sees must be completely different too.
Oh, totally different. This is where it gets really interesting, and the sources really stress how location dictates the symptoms.
Right.
For a cervical mucocele, you see that classic, soft, fluctuant swelling in the neck. Fluctuant just means it feels liquidy when you gently press it.
Got it.
Usually appears gradually. Often minimal or no pain, though maybe some discomfort right at the very beginning, the acute phase, and then get quite large.
Okay. And the ranula?
The ranula under the tongue. That's a bluish red or sometimes translucent, fluctuant swelling right there.
Visible.
Yeah. Sometimes if the animal bites it, it gets blood-tinged. It might make eating or drinking uncomfortable. That's dysphagia, or mess with grooming. It can rupture temporarily, which gives some relief, but the saliva keeps coming, so refills pretty quickly.
Ah, right. Keeps recurring.
Exactly. Now, the pharyngeal mucocele, this is the one that can be really serious, potentially life-threatening, and it might show no external swelling at all.
No lump?
Nope. The signs are all about pressure on the airway and throat. You might see severe respiratory distress.
Like trouble breathing?
Yeah, noisy breathing when they inhale. That's inspiratory stridor, or just general difficulty breathing, dyspnea. They might cough, gag, struggle to swallow, even move their tongue abnormally.
Wow.
Because it can block the airway. Getting that sorted is an emergency.
Yeah.
If you look in the mouth, you might see a bulging mass way in the back. Remember that miniature poodle link?
Yeah.
They might just show up gasping for air, and you'd never guess, oh, salivary gland.
That's terrifying. Okay, and the zygomatic one behind the eye?
Right. So the signs are all eye-related, ocular. The most striking thing is often exophthalmos.
Meaning?
The eyeball is bulging, protruding forward.
Oh, wow.
You might also see swelling and pain around the eye, the third eyelid sticking out, maybe the eyes looking outwards. That's divergent strabismus. Yeah. And potentially even pressure on the optic nerve affecting vision. Opening the mouth might be painful too because of the pressure back there.
Jeez.
And that bulging eye can lead to secondary problems like conjunctivitis or the cornea drying out and getting damaged.
Man, so a neck lump versus eye bulging versus not being able to breathe, all possibly from the same root cause, just different locations. That's one of those connections the sources really bring out.
It really is.
So what causes the initial damage? What triggers this leak?
That's the million-dollar question, and honestly, the sources say the exact cause is rarely identified.
Really?
Yeah, a lot of cases just get labeled idiopathic, which is just medical speak for we don't know the cause.
Huh.
But they list several suspected culprits. Trauma is the most commonly suspected, though proving it is tough.
Like a knock or something?
Could be blunt trauma to the head or neck, rough play, getting hit, maybe even from tight choke chains. Or bite wounds, things penetrating.
Okay, physical injury.
Exactly. It could also be iatrogenic, caused unintentionally by medical treatment, like certain ear surgeries, procedures near the parotid duct. Even removing part of the jaw could potentially damage a duct.
Ah, okay.
Less common suspects are things blocking the duct itself, like tiny salivary stones. Sialoliths, they're called, or scar tissue blockages, foreign bodies stuck in there, maybe even a tumor pressing on it.
So blockages can cause rupture?
Potentially, yeah. And while inflammation or infection of the gland sialoadenitis isn't a direct cause of the mucocele itself, severe inflammation could maybe damage the ducts.
Right.
One source even mentioned dirofilariasis, heartworm disease, as a possible link, but it's not a major theory. But yeah, ultimately, the high number of idiopathic cases suggests maybe there are subtle weaknesses or perhaps even autoimmune things going on that we just don't fully understand yet.
It's wild that the cause is so often a mystery. And once that damage happens, saliva leaks, the body walls it off. But how does it keep growing if it's walled off?
Ah, that's the pseudocystis part again. The body walls it off with fibrous tissue, right? Creates a contained space.
Yeah.
But the salivary gland that got damaged, it's often still producing saliva.
Oh.
So it's like having a leaky faucet pouring water into a sealed bucket. The water keeps coming, the gland keeps pushing saliva into that pseudocystis cavity, and the bucket just keeps filling and expanding.
Ah, okay, that clicks. Continuous production into a closed space equals growing swelling. Got it.
Right.
So you have a pet, varied swelling or symptoms.
Hmm.
How does a vet know it's a mucocele? Rule out an abscess, tumor, other stuff.
Right, the diagnostic process usually starts with getting a good history from you, looking at the pet, feeling the swelling, carefully palpation.
Standard stuff.
But the absolute key diagnostic step, highlighted everywhere in the sources, is aseptic paracentesis.
Fancy term for.
Just carefully drawing fluid out of the mass. Sterile needle, syringe, get a sample.
Okay, getting the fluid, what are they looking for in that?
The fluid itself is usually very characteristic according to the sources. It's typically viscous, kind of thick, sticky, maybe stringy. Color can range from yellowish to clear, maybe blood-tinged if it's been irritated like a chewed ranula.
Right.
But the real defining features, it has a very low cell count. And crucially, unlike blood or pus, it does not clot.
No clotting.
That combination, low cells, no clotting, is a major giveaway that it's saliva leakage. Then you look under the microscope, cytology.
What does that show?
You'd see big clumps of mucin, that's the main protein in saliva mucus, some big cleanup cells, phagocytes, maybe a few salivary cells, usually very few inflammatory cells like neutrophils.
So mostly just saliva components.
Pretty much.
Yeah.
And using a special mucus-specific stain, like PAS stain, that confirms it by highlighting the mucin. Definitive diagnosis, really.
Okay.
The sources also mention sometimes they compare enzyme levels, like amylase, in the fluid versus the blood. Saliva often has higher levels.
So the fluid tells the story. What about imaging? X-rays, scans? Always needed.
Not always for a straightforward neck mucocele, confirmed by the fluid. But imaging becomes really valuable for complex cases, or those tricky locations like the pharynx or behind the eye.
Makes sense.
Plain X-rays can sometimes spot rare salivary stones or foreign bodies, or help rule out big tumors or bone issues if the fluid isn't totally clear-cut.
Okay.
There's something called sialography, injecting contrast dye into a duct. But it's tricky to do, might make things worse, so it's reserved for really complex situations like post-surgical problems. So
Not routine.
definitely not. The gold standard imaging mentioned for neck and throat mucoceles is ultrasonography.
Ultrasound?
Yeah. Excellent for confirming it's fluid-filled, helps ID the gland involved. Usually that mandibular sublingual complex shows how extensive it is.
And for the throat ones?
Critically, it helps assess how much it's pressing on the airway. Very important. And for the zygomatic ones, behind the eye, a retrobulbar ultrasound can often show that fluid cavity too.
Okay. And for those really deep ones, or the eye ones?
That's where advanced imaging like CT or MRI comes in. Essential, really.
Why assumption?
For zygomatic mucocele, these scans map out the whole extent behind the eye, clearly differentiated from other orbital masses or bone problems. Vital for surgical planning.
Gotcha.
They're also really useful for complex or recurrent neck-throat cases, or when you really need to be sure it's not some other kind of mass.
Yeah.
It's crucial for the vet to think about differential diagnoses, all the other things it could be, to make sure they do the right tests.
Right. Abscess, hematoma, tumor. That rule is out. Okay, diagnosis confirmed. Fluid looks right. What's the treatment? Can you just drain it?
Well, first things first, if it's a pharyngeal one causing severe breathing issues, that's an emergency.
Right, airway first.
Exactly. Might need intubation, maybe a temporary tracheostomy. Sometimes you might even need to quickly drain it through the mouth wall before you can even intubate.
Wow, okay.
But for the definitive treatment of the mucocele itself, the sources are crystal clear. Just draining the fluid is not curative.
Not curative, why not? Isn't the fluid the problem?
It's a problem, but not the root problem. The damaged gland is still leaking.
Ah, the leaky faucet analogy again.
Exactly. Drain the bucket, but the faucet's still on. It'll just fill right back up. The sources strongly advise against just repeatedly draining it or trying to inject stuff sclerosants to scar it closed.
Why not injection? Sounds like it might work.
They say it's contraindicated as a definitive treatment. Doesn't work long-term, and worse, it can make future surgery way harder. Causes inflammation, infection, can turn the mucocele into an abscess. Lots of scarring.
So trying the easy way makes the real fix much harder.
That's a key takeaway.
It really is. The definitive treatment, the gold standard recommended everywhere, is complete surgical excision of the involved salivary gland and its associated duct, plus draining the mucocele during surgery.
Remove the source.
Precisely. For that common cervical type, it usually means taking out the whole mandibular gland and the major sublingual gland on that side. They run together, often hard to know which one started it.
Okay. Both of them. Typically, yeah. For a ranula under the tongue, usually involves removing the major sublingual gland. There's an alternative called marsupialization,
What's that?
surgically creating a permanent opening from the mucocele into the mouth, so it just drains continuously.
Huh. Does that work?
It can, but the sources note it has a significantly higher recurrence rate than just taking the gland out.
Ah, okay. Riskier.
And zygomatic ones need a specific surgical approach, going into the orbit to remove that zygomatic gland.
Right. So surgery is key. What about recovery after the operation?
Prognosis with complete surgical removal is generally excellent, according to the sources.
That's good news.
They do note, though, if the site was infected beforehand or if someone tried injecting stuff, that complicates the surgery and recovery.
Makes sense.
Post-op care involves monitoring the site, maybe bandage changes if a temporary drain was placed like a Penrose drain. Those usually come out in like 24 to 72 hours.
Oh.
And marsupialization sites just heal over time. Medications usually include preventative antibiotics and definitely pain management. Antibiotics before surgery only if there was already an infection.
Got it. And complications. Does it come back often?
Recurrence is listed as the most common complication.
Oh.
But with proper, complete removal of the right gland complex, it happens in less than 5% of cases. So, pretty low risk if done right.
Okay, that's reassuring.
When it does recur, the sources say it's almost always because the gland wasn't fully removed, or maybe the wrong gland was identified as the source.
Operator error based
But we're just tricky anatomy sometimes.
Mhm.
And yeah, marsupialization for rannulas definitely has a higher recurrence rate.
Right.
For the zygomatic ones, specific risks could be infection in the eye socket, orbital cellulitis, or maybe damage to the eye itself during tricky surgery.
Okay. So good prognosis if the surgery is done correctly. Now, you said way back that these are much more common in dogs than cats.
Yeah, 3 times more.
Any other big differences between dogs and cats?
Based on the sources, not really, apart from that frequency. The condition seems to behave remarkably similarly.
Oh.
Yeah. The mandibular sublingual complex is the most common source in both. Cause is often idiopathic in both. Clinical signs depend on location in both. Diagnosis fluid tap, ultrasound, CT-MRI, similar approaches in both.
Huh.
Definitive treatment is surgical excision in both. Zygomatic ones, though rare, happen in both. Cause exophthalmos in both. Even those rare salivary stones are extremely rare in both.
Wow.
So really, the main difference highlighted is just how often you see it. Much more likely to encounter one in a dog.
That's really clear. Okay, so wrapping up this deep dive from the sources, salivary mucocele, pseudocysts leak saliva. Location is everything dictates the signs, from neck lumps to eye bulging or breathing crises.
Right.
Diagnosis hinges on that characteristic sticky, non-clotting fluid.
Yep, the paracentesis is key.
And the definitive fix is complete surgical removal of the source gland. Trying shortcuts usually backfires.
Exactly. These sources really show how a simple fluid leak can lead to such complex anatomy issues and varied signs. Demands a precise understanding.
Absolutely. And thinking about how often the cause is just unknown, idiopathic, it really makes you wonder, doesn't it? Given that the trigger is so often a mystery, what might that tell us about the subtle bumps, irritations, maybe biological quirks our pets experience daily that we just never notice?
Yeah.
It leaves you thinking there's probably a lot happening under the surface we're still figuring out.
It certainly gives you pause for thought. A lot we don't see.
Well, that wraps up this deep dive. Thanks for joining us to explore this surprisingly complex topic, all drawn from these sources.
My pleasure.
We'll see you on the next one.